May the come to order. Court is again in session.
Thank you, Deputy Jones. In the case of People versus Murray, Dr. Murray's present with his counsel as earlier today. The People by their counsel as earlier today. Firefighter Senneff once again is on the stand, as are all the jurors and the alternates. Good afternoon, everybody. Ladies and gentlemen of the jury, you are the fastest lunch eaters in the history of jury service. I hear your little pitter-pat as you leave to go to lunch, and then I blink, and the next thing I know, you're back. Take a little more time during lunch, please. Enjoy the wonderful cuisine. Firefighter Senneff, good afternoon, sir. Do you acknowledge you are still under oath and still sworn to tell the truth?
Yes, I do.
Thank you. Resumption of cross, please, Mr. Gorgian.
Thank you, Your Honor.
Thank you.
Good afternoon, Mr. Senneff.
Good afternoon, sir.
We left off talking about CPR, correct?
Yes.
And how it's not unusual for somebody to request for assistance at the time of CPR, correct?
Correct.
Okay. And is it also fair to say that the resuscitation should be conducted where the patient is found?
That would not be correct.
Okay. And you indicated earlier you're familiar with the American Heart Association guidelines, correct?
Correct.
Okay. And isn't it true that the guidelines provide that because of the difficulty in providing effective chest compressions while moving a patient during CPR, resuscitation should be conducted where the patient is found? Would you agree with that?
Yes.
Okay. And previously you testified that when you observed Mr. Jackson, he had an IV tube connected to his leg, correct?
Correct.
Okay. Did he also have a nasal cannula hooked up to his nose?
I did not see a cannula.
Okay. Did you...
I'm sorry, can you spell that?
Cannula.
You may want to inquire as to exactly what that is.
And what is that, Mr. Senneff?
A nasal cannula is a way of providing oxygen to a patient through their nose.
Okay. And did Mr. Jackson have anything else connected to any of his body parts?
I did not see anything else.
Okay. And would that also be a factor to consider whether to move a patient during CPR?
Yes, it would.
Okay. And that's also reflected in the American Heart Association guidelines. Isn't that correct?
I don't know, sir.
Okay. Now, if you're getting adequate and effective chest compressions, okay, and they're being provided at the appropriate depth and rate, it's irrelevant whether the compressions are on a bed or on the floor, correct?
Correct.
The prosecutor, Ms. Brazil, asked you some questions regarding a pulse that was felt only by Dr. Murray. Isn't that correct?
Yes.
You recall that testimony earlier?
Yes, I do.
Okay. And when Dr. Murray indicated that he felt a pulse in the groin area of Mr. Jackson, you didn't think there was anything suspicious with that, did you?
No, I did not.
Okay. I mean, you didn't think he had any ill motive or any bad purpose of saying that, did you?
No, sir.
Okay. In fact, you've previously testified in this case, correct?
Yes.
And when this issue came up, isn't it true that you testified when you do gut CPR, it's common to get a femoral pulse from the CPR, correct?
Correct.
Okay. So it's very likely that Dr. Murray did, in fact, feel that pulse, correct?
Correct.
And that's precisely why you stopped doing the compressions, correct?
Correct.
Because you wanted to check and see whether that was a real pulse or whether it was an artificial pulse due to the compressions, correct?
Yes, sir.
Okay. Now, after the CPR and administering the medications you referred to earlier, UCLA at a certain point tells you to call it, correct?
Correct.
And you weren't comfortable with calling it, were you?
Was I uncomfortable with calling it?
Yes.
I would have preferred to continue, yes.
Okay. And you would have preferred to gone to the hospital because this was a VIP person, correct?
Because it was a VIP, yes, but also because potentially it was a recent arrest.
Okay. And in fact, Dr. Murray wanted to continue it as well, correct?
Correct.
And in fact, that was reflected in the call we heard earlier, correct?
Correct.
Where you tell UCLA the doctor here wants to definitely transport, correct? And by that it means let's continue, please, correct?
Yes.
Okay. So Dr. Murray assumes control and full responsibility, correct?
Correct.
Okay. And because of that, he then has to go with you in the ambulance, correct?
Correct.
And that's according to protocol, correct?
Correct.
Okay. When a physician assumes control, he needs to ride in the ambulance with you, correct?
That's correct.
Okay. So after you transport Mr. Jackson to the ambulance, you then head back upstairs, correct?
Correct.
And you went back upstairs so you can pick up the medical equipment that was left behind, correct?
Correct.
And when you got upstairs, you saw Dr. Murray, correct?
Correct.
And Dr. Murray was also picking stuff up, correct?
Correct.
Okay. And he was doing that right in front of you, correct? In plain sight.
Yes.
Okay. He didn't ask you to, oh, Mr. Senneff, can you please wait outside for a minute? Correct?
No, correct.
Okay. He didn't ask you to wear blindfolds or to close your eyes in any way, correct?
Correct.
Okay. And you would agree that picking up the equipment that was left behind is the appropriate and the medically reasonable thing to do, correct?
Correct.
Okay, especially in light of the fact that children reside at their residence, correct?
Correct.
And did you see what Dr. Murray was in fact picking up?
I did not.
Okay. Isn't it true he was picking up his wallet and his glasses?
I don't know, sir. The bed was blocking right where his hands were, the line of sight.
Okay, and then Dr. Murray meets you at the in the ambulance?
Yes.
Okay, and how much time do you estimate passed between you leaving the room and Dr. Murray joining you?
Moments, minute, 2 minutes,
Okay.
not long.
Could it have been less than a minute?
Before he joined me in the ambulance?
In the ambulance.
Around a minute, somewhere around there.
And the prosecutor asked you about a phone call that was placed by Dr. Murray in the ambulance, correct?
Correct.
Okay, do you know who he had called?
No, sir.
Do you remember the substance of the conversation?
No, sir.
And you indicated you arrived at Carrollwood at approximately 12:26, correct?
Correct.
Okay, and you and your team did your absolute best job in trying to bring life back into Mr. Jackson, correct?
Correct.
And would it be fair to say that Dr. Murray also did everything in his power to help Mr. Jackson at that time?
From the time I walked in
Yes.
to the time I left?
From what you observed?
Yes.
I mean, he wasn't just standing around and talking on the telephone or researching the computer, correct?
No, he was not. That's
okay,
correct.
I mean, he was trying to help you with whatever he can,
Correct.
correct? And at no time while you were there did Mr. Jackson's condition improve in any way, correct?
Correct.
And isn't it true, Mr. Senneff, one of the signs of good CPR, effective compressions, is when the patient suffers fractured ribs? Would you agree with that?
It's common when you start chest compressions to hear the cartilage where the sternum right here, where the ribs attach to the cartilage, right there, it's common to hear that crack.
Okay, and in this case, are you aware that Mr. Jackson had sustained fractured ribs?
I was not aware of that.
Okay. Now, the prosecutor also asked you whether Dr. Murray ever mentioned propofol. Do you recall that?
I do.
Okay. Are you familiar with propofol?
Not really, no.
Okay. Do you know that it's got a very short and very rapid clinical effect?
Objection, relevance.
Sustained in view of the prior answer.
Okay. And earlier you mentioned PEA. Is that pulseless electrical activity?
Yes, sir.
Okay. Can you explain to the jury what that means?
Pulseless electrical activity. On the cardiac monitor, you can normally see a heart rhythm. That's we're all familiar with. We've seen it in all the movies, that sort of thing. Pulseless electrical activity is when you have minor electrical activity on the monitor, but no pulses go with it, which is to say that the heart itself is not contracting and making a pulse. But the heart's pacemaker somewhere in the heart may still be firing off electrical activity.
And Mr. Jackson in this case was PEA, correct?
He was a combination of asystole and PEA.
Correct. Was it initially asystole and then PEA? Is that kind of what happened?
It floated back and forth between the two.
Okay. And when a patient is PEA, there's certain protocols you need to follow, correct?
Correct?
I mean, there's only so much different treatments you can render when somebody is PEA, correct?
Correct.
For example, and I believe you had testified to this at the preliminary hearing, you wouldn't defibrillate or shock Mr. Jackson, correct, when he's PEA?
Correct.
Okay. And what you do when somebody is PEA is you can give CPR, correct?
Correct.
And you can give the medication that you previously testified to, which was epinephrine and atropine?
Correct.
Was there anything else you could have done?
I'm sorry, the last part?
Was there anything else that you could do for a patient who is PEA?
Sodium bicarbonate, as we gave. Over time, sometimes they'll order calcium. That's about it.
Okay. So isn't it true that you would have done absolutely nothing different because you could not, had Dr. Murray even mentioned the propofol?
Objection. Lack of foundation. Cause for speculation.
Sustained.
Nothing further, Your Honor. Thank you.
Gorgian, thank you. Ms. Brazil, redirect.
Thank you, Your Honor.
Thank you.
Mr. Senneff, Mr. Gorgian, in his questioning to you, characterized the activities of your resuscitation efforts as being sort of confused and chaotic. Do you recall that?
I do.
Was there any confusion or chaos during the performance of the life-saving activities supervised by you and carried out by your team?
No, there was not.
With regard to the tubing near the IV site, you don't know whether tubing was replaced or removed or placed again prior to your arrival, do you?
Prior to my arrival, no, ma'am.
With respect to the femoral pulse that Dr. Murray advised you that he felt as a result of your verification process by yourself and your colleagues, you're satisfied that the pulse was a result of compression and not an actual pulse in Mr. Jackson's body. Is that accurate?
That is accurate.
Mr. Gorgian asked you about your observations of the defendant when you returned upstairs to retrieve your medical supplies. Would you characterize your impression of the look on Dr. Murray's face when you returned to the room?
He was surprised to see me.
Why do you say that? Was it by the look on his face?
By the look on his face, he turned his head. He was partially bent over. He turned his head sideways to look at me, and just blank look right off the bat. Just surprised. I had the impression he was surprised someone just walked in the room.
Did you characterize that as a deer in the headlight look?
I have characterized it that way.
And you have previously testified to the jury that when you saw Dr. Murray in that location by the nightstand area, by the bed, he also had a trash bag in his hand, correct?
That's correct.
During the more than 40 minutes that you were at Mr. Jackson's side, did you ever see any signs of life in him?
I did not.
Thank you. Nothing further.
Ms. Brazil, thank you. Mr. Gorgian, recross.
Mr. Senneff, how long would you say,
I'm
Mr.
sorry, could you
Yes.
just take a moment? Thank you.
When would you estimate the time of arrest to be with Mr. Jackson?
That's really hard to speculate on, sir.
Okay. That question was asked of you at the preliminary hearing in this matter, correct?
Correct?
And isn't it true that your testimony was anywhere from 20 to 25 minutes?
I was asked several times